Hi, my name is Dave. I have over 19 years of experience working with the neurologic population. Today I wanted to show you how the FreeStep SAS can complement you in your treatment intervention techniques when you're working with patients with Parkinson's disease. One impairment that you may encounter in a patient with Parkinson's disease is this stooped posture, where they're flexed forward, their head is flexed forward and their arms are internally rotated. And one way that you can address it is in a seated position. If this is not dealt with, this can lead to some permanent changes in this position and ultimately affect a person's balance. So when we're treating a patient, it's important that if they present like this, that we're working on alignment and ultimately static sitting balance. So I'm going to use the combination of the FreeStep and my therapeutic intervention techniques to get him up and aligned and for him to be able to activate these muscles in his back. So the first thing I'm going to do is, as you notice the FreeStep, it's in a nice loose position, okay? And Lewis here is in a flexed forward position, again, of what you would see with a patient with Parkinson's. So I might come up to the FreeStep first, all right? Give him a little bit of a pull, which is going to give him a cue to sit up a little bit taller. So go with the movement and just around there. I don't want to raise it too tightly and too much. I just want to provide that just right challenge because I want him to be able to do the work. Once I feel comfortable with where it's positioned, I'm going to take over with my hands and get him to extend up a little bit further so he is engaging in his back muscles in this thoracic region and in the cervical region. Now that he's aligned, we're going to work on some arm exercises to break some of those slow movements and the rigidity that he may have from the Parkinson's. Now I'm also looking at his alignment. Keep on doing that, a little faster, a little higher. All right, now from here, I want you to take the ball. I want you to raise it up nice and tall as you can. Engage those back muscles. Good, bring it back down again. Further work on this posture alignment is doing two things at once. So this is a functional activity, pouring one glass into the next. We're going to do some high stepping, so right side and then back and forth. Higher level Parkinson's patients, they still might have those bent over issues in which we still want to work on straightening them up and working on alignment. Once I get it to a level where I want them to be, we're ready to do our exercises.